Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
Welcome to the show. Thank you. This is really where everything starts because the word dizzy on its own doesn't tell us enough. So, when someone says, I feel dizzy, what are you trying to understand first? I try to understand what that feeling is like. I might ask, does it feeling like spinning, like you might pass out, or like you are just unsteady? Then I ask, when does it happen? What brings it on? How long does it last? And very often, just that conversation gives us most of the answers even before we do any tests. Let's walk through the main types of people confused with vertigo. First is pre-syncope, which means feeling you might faint. People often say, I feel lightheaded, things go a bit dark, I feel weak or sweaty. This usually points to things like low blood pressure, dehydration, or heart related issues. So, this is very different from a balance problem. Then there is another problem called disequilibrium. This is more of a steady unbalance. People might say, I feel wobbly, I am not steady, I might fall. There is no spinning, just a feeling of instability. This can happen for different reasons. Sometimes nerves in the feet are not giving clear signals. Sometimes vision is not helping balance properly. Sometimes it's a medication. Or sometimes just affecting balance in more than one way. Another common one is orthostatic hypotension. That's when your blood pressure drops when you stand up. You might feel briefly lightheaded, slightly faint, or like you need to sit down again. It usually lasts a few seconds, and again, it's not a vertigo. Now, let's talk about something patients often hear anxiety. And sometimes that can feel dismissive. Yes, this is really important. Anxiety can cause real physical symptoms. For example, fast breathing can make you lightheaded. Panic can make you feel unsteady. But there is also a condition called PPD, persistent postural perceptual dizziness. This is very real. It often starts after something like an episode of vertigo, an inner ear problem, or even a panic attack, and then continues as constant feeling of being off balance, worse when standing, worse while moving, worse in busy places like supermarkets or crowds. That's something many people describe, especially in visually busy environments. Exactly. The brain becomes more sensitive to movement and visual input. So even if tests come back normal, the symptoms are still very real. And importantly, this is not just anxiety. It is a recognized condition with clear diagnosis and treatment. So how do you tell PPD apart from ongoing inner ear problem? PPD lasts for months, is triggered by movement and posture, and gets worse in visually busy environments. Tests may be normal and that can be confusing. But when you look at the full story, it becomes clearer. And if someone listening still feels unclear about their diagnosis, what should they ask? Ask for a clear label. Instead of just dizziness, ask whether is this vertigo, is this pre-syncope, or disequilibrium, or PPD. Because once we name it properly, we can treat them properly. Before we finish, here there are key takeaways. One, dizziness is not one thing. Different types feel different and comes from different causes. Two, PPD is a real condition, often triggered by an earlier event and worsened by movement and visual movement environments. Third, getting a clear diagnosis matters. More specific the label, better your treatment plan. And if this sounds familiar, you are not alone. It's okay to ask for clarity. Absolutely. That clarity is the first step towards getting better. Thank you.
Thank you, doctor, for your valuable advice and guidance for patients. A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.